This one. I can change it, yes.
But it's not changing.
But
the
it's
screen.
not showing your.
Oh, what do you mean?
Just a second.
It's not changing in our slide, ma'am.
Yeah, just try changing the slide.
What?
भाई actually
So we'll do one thing.
we cannot screen share ना, अगर हमने screen share किया तो ये ऐसे हो जाएगा.
No screen share.
You will have to share your screen because we cannot screen share because we are streaming this live. Just try sharing your screen and open that PDF.
Yes, ma'am, this will work. Ma'am, can you download that PDF once more? Just click on download.
ये downloaded में ही गई है.
Downloaded में ही. It's
Just click on these three dots if we can just. Yeah, just there is one folder button here down. Can you click there?
Where? This one?
Down on your screen there is Zoom and there are two Chrome extensions and there is one folder.
one to the right, ma'am, right.
Right one, folder one. Click on that folder. Right,
This
right.
one?
No. Right
No,
side.
no.
Yeah.
Yes,
Folder,
ma'am,
yellow one.
Yellow one.
Click there, yes. Can you go back? No, you are just exit this current file you are in.
What?
Can you just exit the current screen which you are sharing? Just come out of that. There is one arrow on the left hand side corner. Just come out of this file. Yeah. Click that arrow.
So now?
Is it this one?
We cannot see the PPT which you have downloaded. Again. No.
What if we share only PPT as option?
Do one thing. Just open the PDF which you had downloaded.
Okay.
Let's start.
Yeah, because we are running out of time. That was the reason I asked you to join early. Now we just have to.
Not this.
Just no. This is not the thing which we downloaded. Open the PDF.
This one?
This one, yes.
That one.
Can you just click on these three lines over here in the left hand side? 1 second. Let's see if it works. You can see three lines on the left hand side just beside your topic. Can you click that?
Okay.
Yeah, okay. And just make it full screen.
It's full screen.
Maximize it.
Full screen.
That is maximum.
No. I think so. This is the maximum. No. Come wherever you were earlier.
No, that the other one is the maximum. We'll put there.
Come to the PDF, which was open.
No, ma'am. The last one you were on, the one,
your presentation. Please open your presentation.
Yes,
yeah. Now we'll have to start with the live. Just scroll down if you're able to see all the slides. Please come to the first slide. You are on the 5th slide. Please come on the first slide. अपने में भी full screen आ रहा है, इसमें कैसे नहीं हो रहा है?
हमने Microsoft Edge में download करें. So in Microsoft Edge you can get screen. अभी भी हमारा screen share हो रहा है.
नहीं वो उधर ऐसा हो रहा है. Please come to the first screen.
Yes.
We are getting late. We need to start the live.
Yeah.
Please come to the first screen, first slide of your presentation.
Okay, you have to scroll
Yes,
like
this one.
This is the fourth slide. Come to the first slide
Yes.
of your presentation.
just scroll up, ma'am. Scroll up.
Scroll up. So
Yes,
we are
ma'am.
starting the live
This one?
now. Yes.
Yes, ma'am. This one.
We are starting the
Okay.
live now. We will be
Yeah.
switching off our camera and our audio, and then I'll be just leaving a text in the message box. Are you able to see the messages in the Zoom box, Zoom chat box? I've sent an hello.
Zoom chat box.
Yeah. Are you able to see the hello which I have sent you?
Yes.
Okay, so once we are live, we see people joining us, we'll just put a message. You can start with the live, and then you can start with your presentation, starting with your introduction, and then accordingly you can show your slides by scrolling them down.
Okay.
Okay? I'm starting the live, I'm switching off my camera and audio. And once you're done with the live, just ask the audiences if they have any questions, they can ask. And then if there are any questions on the Facebook Live, I'll paste it them here in the Zoom chat box. In case if we do not have any questions, I'll just add, you can end the live.
If there's any question. Hello. Good evening. It is evening here in Dar es Salaam. Yeah, my name is Eva Mbogo, a special need teacher. I'm working in primary school here in Dar es Salaam, Tanzania. I'm here to just discuss about understanding autism spectrum disorder. I'm a woman, married, blessed with 3 kids. Yeah, we are happy family. I have a bachelor degree in special need education from Sebastian Koloa Memorial University from 2010 up to 2013. In 2018 up to 21, I obtained my master's degree in educational management and planning. Yeah. My degree, this special need degree, I specialized in speech impairment. So I specifically work with children with autistics and also autism and those with deaf and other disabilities also. Yeah. I've worked since 2015 with these children with special needs. And on 2022, I began supporting children with autism spectrum disorders. Up to now, in this Ubungo Municipal here in Dar es Salaam, Tanzania. Yeah, I'm happy with my job. It is a very good one. I'm talented on it. And I thank God also. I think this is a God-given gift because I was born on 3rd December, the day of Disability Day, where UN emphasizes giving us awareness on caring on these people with disabilities and know them, they are able, they are capable, they are like other people. Now let's go direct to our topic because we are late. Understanding spectrum disorders. I've always been passionate about supporting these children who experience unique challenges. And children with autism, they exhibit behavior that deviates from our society, which we consider socially normal. But it is important to acknowledge them. It is important to know that they are capable, to acknowledge them, to uplift them, so that this will highlight their individual talent because they are not empty. They have something given from God. My goal is to bring the learning gap between these neurodivergent and those neurotypical children. I inspire to educate also parents on navigating life and education to raise the awareness on this social behavior of children with autism. What do you know about autism spectrum disorder? There is misconception. People have misconception on these children. Some think, oh, they say that they look different. Some they say that they don't feel emotion. They always exhibit obsessive tenderness. Others say they can't communicate. But now let us see what is autism spectrum disorder. According to the US Institute of Deafness and Other Communication Disorder, we see that autism spectrum disorder is a developmental disability which can cause significant social, emotional, and behavioral communication and behavioral challenges. Yeah, according to the Dr. Stephen Shaw, Doctor of Education, he has this saying, say that if you have met one person of autism, it means you have met a person with autism. You can say, what does it mean? Yeah, it means children with autism are unique. They are not all the same. They have, it is spectrum, it is a spectrum disease. So some are severe, others are moderate, others are mild. So you cannot generalize them, say they are so and so and so. So they are very, very unique, and their capability also is unique. Let us continue to understand autism spectrum disorders. Here we'll look on 3 angles. We have communication challenges. We see social interaction issues, social interaction, and behavioral challenges. Individual may experience some delays in speech manifestation and difficulties in expressing themselves verbally. Although some autistic children speak fluently, others may be completely nonverbal. In social interaction issues, most of them, they isolate themselves from their peers. If you want to, you join them with their peers, you want them to play together, you want them to read together, to do any activities together, they just isolate themselves and want to do them alone. Autistic and behavioral challenges are often reiterate and copy behaviors. Some autistic children may harm or injure themselves as communication attempt. So it is very, very important to be close with them, to tolerate them, to love them, to show them love. And some think that if you love them, they will be more severe. No, they want to feel someone is loving them. They want to feel that they are cared. So because they have this difficulty in communication, and some people ignore them, maybe parents or caregivers or anybody despise them. They now become aggressive because of that. So to help them, it is better to handle them and to care them. speech delays in children with autism and its implication. Let us see now speech delays, types of speech delays, implication of nonverbal behaviors. Most children begin speaking and expressing themselves verbally around the age of 1 or 1.5. However, children with autism often start talking much later, between the age of 4, others between the age of 5. They delays. Some of them, they delays. And it is important also to note that some autistic children may develop verbal skills, but their speech might be limited to practical speech. Meanwhile, there are some children with autism who may not become verbal at all. Implication of nonverbal behaviors. Speech delays can impact their learning capabilities once they are enrolled in school. It is vital for teachers and other caregivers to accommodate autistic children and so that they will adapt teaching and adapt teaching method according to them. At the school, it is better for schools to prepare and to have at least to press them when they come at the first time at school and see that these children has this problem, and better to give them a proper or a method, good teaching method for them. Let us see now about sensitivities. Yeah, they have a problem also on sensitivities. Some have low hypersensitivities and others have high hypersensitivities. And this is on taste, on touching, on smell. So it is better to bear with them because this is very difficult time for them. They may have either low or high. So better for parents and caregivers to be with them, to help them accordingly. Characteristics of children with autism and speech delays. Yeah. Now here we can see how to know how to understand or to think of if a child has autism or not. The characteristics is like this: the child have sometimes walk on their toes. They walk on their toes like wearing a high heels, and because of these sensitivities, others engage in head banging. They bang their heads, and as they try to make communication and difficult, or sometimes hearing a voice, a loudly voice, so they feel bad, then they start banging their heads. They use repeated faces. They exhibit some aggressive behaviors and show echolalia. Echolalia is when you talk to them something, they repeat it. They repeat it. Sometimes they repeat earlier, sometimes they repeat later. For example, say, yeah, how are you? Continue say, and also instead of say, I'm fine or I'm okay, say, also the answer, how are you? So they are like that. Their behaviors are ranging from mild to severe, and it is important to make diagnosis early. So you go to see doctors, and the doctors will give you the instruction or will direct you how and where, how to support them. Causes of autism spectrum disorders. There's no link to autism. I can say there's no, this is autism, but it is presumed that some factors such as drugs and alcohol using during pregnancy period may contribute to this ASD. Additionally, it may also be hereditary. because of these genes, and some can inherit it from parents or grandparents or other relatives. In my personal experience, I found slight correlation between parents who have chronic illness and the children with autism. Let us see how early intervention can improve communication skills in these children with autism. And when we talk about early intervention, it means to take action against the problem of the pupil with autism earlier, so that the problem or the disability to not occur, or to occur, but even if it will occur, it will not be severe as it was have to be before early intervention. So how to do this early intervention? We see early parental education strategies. Parents have to be educated about these disorders, and to go early to diagnose their children and begin intervention strategies, so that to address those non-behavioral tendencies as soon as possible. Also, social exposure strategies. To enroll a child in school early can significantly enhance individual familiarity with their peers. In school, they play, they interact, they see that other peers are responding to teachers, they see how they respond, so they learn. Even at home, they are learning. When parents, you have to encourage talking to them. Don't talk to them harshly. Don't talk to them in a difficult language. Just use simple language. And also don't use those phrases or words which are, maybe you say, pull your socks. So autistic children will understand, okay, let me take my socks and put on. Step up. So you have to use those language which is very, very common, easy, and wherever a child is not understanding, continue with a passion to tolerate them and continue without being tired. And be persistent, educate them. Yes. Social exposure. Yeah, children with the autism, they become more comfortable and they practice social skills with other children. They are very, very happy when you expose them to other children, and slowly, they improve instead of staying at home alone. Conversation, before conversation. Yeah. Here we can say conversation of a child or for a baby starts from the beginning. Yeah, I can say from the mother's womb. So we encourage parents, or we advise parents to talk with unborn babies, so that they start familiarize their parents' voice of a mother, voice of a father. So they start also knowing that this is a language they understand, even if they are in the womb. So it is better to start conversation with these children before conversation. The baby who was used to talk before born is different with that one who was used to talk or to hear her mother or her father's voice since he was in the womb. Thank you. The option or treatment option. There is no specific cure to this disorder. However, behavioral therapy options can aid in addressing special delays. Utilizing speech therapy can promote and improve verbal communication in individuals with ASD. So speech therapy, they can have families or parents can it is better for them to go to speech therapists so that they can have this speech therapy. It will help them because speech we use mouth as we talk, and so also mouth, or can say face, is also like other things in the body of human body, like hands, legs. So as you continue exercise it, also it becomes stronger and stronger. Exercise like pulling what, blowing air, or use straws in drinking waters. That is a mouth exercise, which can help or can aid in speech therapy to children. Speech therapy also can assist in providing the child with tools and knowledge to differentiate certain words, such as letters and numbers. Communication methods. Parents and teachers can opt to utilize sign and gestures to communicate with children. Also, this is helping them. They can use those sign and gestures, they can use pictures. Even if you want something, you can show the child, if you use pictures, he can go and show you pictures. They also to have timely on maybe time for food, time for snacks, also will help them. So at this time, when you see something, this picture, so okay, it is time for food, it is time for this or that, to help them also. That's pictures and gestures and signs. Let us see now the effects of bullying individual with ASD and speech delays. Let me see if there's any questions here. There's no any question till now. Okay, let us go on. Effect of bullying individual with ASD and speech delay. It is very bad and it is not appropriate to bully them. It is better to love them. The behavior of child with autism are still not widely known. Other generation, families, or peers may not fully understand the child tendencies and might consider them rude or impolite because they cannot talk. They say this child or that boy or that girl is not good, etc. As a result, neurodivergent children may experience bullying or face negative from all over. Bullying can affect the individual's self-esteem and revise speech therapy efforts. So even if you are doing all those procedures, speech therapy, anything you do, pictures, etc., to help them, but whenever they face bullying, whenever they face harsh, these things reduce their self-esteem, and also it revives that speech therapy effort. So it's become like there's nothing. You will start every day we start. Instead of bullying them, please let us love them, let us care them. The main aspects of autism spectrum disorder are communication challenges. Individuals with ASD may lack the ability to express themselves appropriately, or at times they may not express themselves. These difficulties are usually interconnected with their behavior in social settings, as they may be unable to interact with their peers and tend to self-isolate. So early intervention can significantly enhance the communication skills of a child with ASD. It is essential to employ early intervention strategies on these children. We'll see also if there is any question. No question till now? Any question? How can we differentiate autism and cerebral palsy? Okay. Yeah. As we talked before, autism spectrum disorder has challenges in social communication and the behavioral difficulties. But cerebral palsy can not only be or appear to children, can also appear in adults. So this is whereby a brain, a hardware damage of a brain, maybe tumor or whatever, and this causes someone to not maybe talk good, or to not communicate, or to not walk or function well in his body. So that is the difference from autism, because autism is not a cerebral palsy. Autism, others are, in their brain, there's no tumor, there's no any problem with the brain. They just have those challenges. That's why I said before earlier that autism causes is not known, but cerebral palsy causes is known. It is because of maybe brain tumor or brain damage, etc. I don't know if I will answer your question. I think it is okay. Let's wait. Maybe there is another question. Waiting for the other questions. No other question now. You can exit the conference. Mary, nishamaliza. Nimemaliza, hamna tena. Siko live.